Acoustic Neuroma. Introduction. Acoustic neuroma is a non-cancerous tumor that develops in the nerve that connects the inner ear to the brain. Select true or false. Correct. All tumors, including acoustic neuroma, are cancerous. Select true or false. Correct. Only malignant tumors, which have the potential to invade other tissues, are cancerous. Benign tumors are not cancerous. Acoustic neuroma is benign, that is, non-cancerous. An acoustic neuroma may affect both hearing and balance. Select true or false. Correct. An acoustic neuroma grows in the 8th nerve. This nerve is responsible for hearing and certain aspects of balance. An acoustic neuroma is caused by the overproduction of Schwann cells on the 8th nerve. Select true or false. Correct. Schwann cells cover nerves. The overproduction of Schwann cells in the 8th nerve causes a benign tumor called an acoustic neuroma. Why can acoustic neuroma be difficult to diagnose? Choose one of the following options. 1. The symptoms are similar to those of middle ear problems. 2. The tumor grows slowly. 3. Early on acoustic neuroma may not cause symptoms or only mild symptoms. 4. All of the above. Correct. Treatment for an acoustic neuroma may involve watching and waiting, radiation, and surgery. Select true or false. Correct. Your healthcare provider will help you determine which treatment option is best for your case.
Thank you for using Explain.